help me welcome Commissioner Emily Bonilla from Orange County. And Gloria Puerta, who is the founder and president of Feed and Fortify. Thanks for being here today. I'll start with Emily. How is Orange County dealing with the influx of Puerto Rican citizens? What has been the response from the state level, and what solutions are needed, or which solutions do you support for dealing with the housing issues in your county?
Well, just to introduce myself, I am Emily Bonilla from Orange County. I'm a newly elected commissioner, and I'm a New RICAN. And I did have a presentation to go through, if you don't mind. All right, so 1,000 Puerto Rican families a month are arriving in Florida. They're leaving the island in search of jobs and a better life. Many hotels and motels are filled and are not cheap places to live. And she knows a lot about this, which she would discuss in her presentation as well. Access to low-income affordable housing is a major challenge in Central Florida region. A report by the National Low-Income Housing Coalition referred to Metro Orlando as suffering the nation's great shortage of rentals for extremely low-income tenants, with only 15 affordable rentals available for every 1,000 extremely low-income renters whose households make less than $18,000 a year. The report rightfully points to the potential for this crisis to yield an increase in the homeless population. We have experienced a rise in the number of families in transition that live in extended stay hotels and motels. There are low-income families and the working poor that are often one paycheck away from homelessness. Many come with savings ready to move into an apartment, and one of the issues is that they find themselves paying application fees only to get rejected. Their savings are gone only after a couple of months of trying to find an apartment. According to the Center for Puerto Rican Studies, Puerto Ricans in the United States make less money but pay more for housing than other ethnicities. In 2016, there were over 1,600 homeless individuals living in Orange, Osceola, and Seminole counties. Orange County accounted for 1,279 homeless. 22.1% of all homeless individuals in Florida are Hispanic. That's a large percentage. Homeless persons are considered those who lack a regular, adequate nighttime residence and those living in shelters and temporary housing. Individuals living in public and private places which are not designated for sleeping are also considered homeless. There are two types of homelessness, which include sheltered and unsheltered. Unsheltered homeless persons live on the streets or in tents, cars, or abandoned buildings. Sheltered homeless persons stay in transitional housing. They live with family, or they're living in hotels and motels. Instead of being homeless, public housing is one way that many families are staying off the streets and have a roof over their heads. This public housing, which is not the main goal, can benefit hundreds of thousands of everyday citizens. However, the side effect of public housing is that it causes concentrated poverty. It goes without saying that underinvestment and concentrated poverty yields less opportunities. We must ensure that we don't contribute to segregation and isolated poverty. Housing patterns that result in both racially and socioeconomically segregated communities and schools. As we know, the causes of residential segregation are historical and include factors such as discriminatory federal housing, lending, highway policies, and white flight, and continue as a result of local exclusionary zoning practices, among other challenges. 25.6% of Orlando residents live below the poverty line. 21.1% of all residents in Florida live in poverty. When we discuss housing and community development, we're really talking about an ecosystem that will shape the quality of education and life for children and families and determine their ability to thrive. This is unacceptable. When one community fails, we all fail. It's our obligation to ensure that as we continue to fuel economic growth, that our increasingly diverse workforce is able to secure a living wage and adequate housing in vibrant communities. Thanks. Every conversation about affordable housing must include a serious look at wages. Rising rents, lack of jobs, and stagnant or unstable wages force many low-income families to move to more often than other families or to live in housing that is overcrowded and poor quality. The National Low-Income Housing Coalition reports state that in Orlando, one would have to earn $19.17 an hour to afford decent housing, with monthly rental payments of about $1,000. But we know that for a family of four, that monthly rent is closer to $1,200. Currently, for those individuals making only minimum wage, a person must work 80 hours a week in order to afford a one-bedroom residence. We all have a part to play. We must continue to move the needle on issues such as increasing the minimum wage, ensuring that consumer protections are at the core of all development, the housing and subsidies are available to families who need it the most, to name a few. However, we cannot simply place a Band-Aid on housing issue with more subsidies. We must hold employers accountable. Employers must step up to the plate and pay higher wages so that all families are self-sufficient and meet their full potential. And I'm going to go off the script just to give you a personal story. My husband and I, we moved down to Orlando from Massachusetts. That's where we were both raised for most of our lives. And we had a minimum wage job. We both worked at Disney and Universal Studios, of all places. And we lived in affordable housing. And we lived there because it afforded us a decent living, a nice housing opportunity with the wages that we were earning. As we lived there over the years, we started making more money. We finished college, and we were doing a lot better. So we were able to move into our first home. And that's what affordable housing can do for many families. So it's very important that we have affordable housing to help people who are getting started to have an opportunity to grow in their career, save up money so that they could buy their first home. But at the same time, we need to think about wages as well. The wages need to continue increasing. And right now, Orange County is the third in the fastest growing job wage area in the whole country. And I want to say, well, thank you to the unions at Disney who was pushing them for a higher minimum wage. They moved their minimum wage to $10, which then we had a domino effect because Universal Studios then had to raise theirs. So if one person starts and we have a leader in the industry, then everyone else will follow. And that's what we need. We need leaders in the industry to start raising the wages, getting better benefits for our employees, and then everyone else will follow, and we'll have a domino effect, and things will get better.
Thank you. Gloria?
My name is Gloria Puerto. I'm not Puerto Rican, I'm Colombian.
All right.
And I was thinking, okay, thank you for inviting me. What I'm gonna say to a Puerto Rican community? But someone tell me, you have to speak by your heart. And that's exactly what I do over 6 years ago when I start a nonprofit organization that helps families in transition. I start helping homeless in downtown, but then I find out that there's a lot of families that arrive to the food shares and then disappear. I start helping, not as my job, because I have a full-time job, and nobody please posting anything, I'm escaped from my job today. No, it's not, no. I have off today to come in and share with you what the statistics are. Because we are getting a lot of information, a lot of education of what the numbers look. But are you ever been in one of those hotels? As a Puerto Ricans, and see all the families that are coming, are you ever participate as a volunteer for any of the organizations out there? So what we gonna do with the information that we're getting here is the most important message that I want to give it to you. Because it's not about how much do you know, but how much do you do. And when we, as a community, get united, not because our countries or because we speak the same language, Even the Colombian is different, I know. I cannot say some words in Puerto Ricans because they're gonna. But here we go. When you cross and you get this country, you get in a pot. We all are the same here. We need to work together as a unity because there's a lot of organizations out there to do duplicate services and don't get the results that we need. This is a domino effect that you say. I mean, it's hard for me, it's heartbreaking that the 100% of the people that I serve in the hotels and the motels, 37% are Hispanics and 87% are Puerto Ricans. But 57% of those communities are kids between babies to 17 years old. That's heartbreaking because we are creating, and what is what we are doing for our future generations? What is what we are saying about opportunities? A good news for the Puerto Rican community and for the Hispanic community es que nosotros somos bien luchadores. We don't stay there forever. And what we need is the support of the legislations, the legislature, the community get together to give a hand, because that's the only thing, is just a hand to make them, given the tools, the education, the resources that they need to get out of there. 3% of the people that I help in the hotels, only 3% is recurring. That means that most of the people that I help just stay at the hotels for a little time, period of time, until they get, and this is an example. We get someone who living in a housing, affordable housing program, and now is a commissioner. What beauty is that? But why? Because we have the power of and empower ourselves. We are seeing here people with high education. Fantastic. Well, we need to assure that the people that are coming in, their people have the resources. Most of the people doesn't have a clue that they have resources out there. And that's what we need to do. You know, it's list of waiting list for people for housing, for affordable housing. Oh, you need to have 38% of your income cannot be your rent or your what you have to pay. Yeah, I earn $8 so an hour. Nobody can qualify. Oh, you have an addiction. Oh, you have a very bad situation in the past and you have records. We don't forget about that, people. We cannot forget about that, because a situation where probably you make a mistake, you pay for that mistake, and then you come out, what are you gonna do if you don't have any program to help that people to go through that? So my call today is pretty much go and help. Identify an organization that you feel comfortable. Try to make your efforts. We have a lot of skills. What are we doing with that skills? These professional people here that have a lot of resources, what we are doing about that? That's why Feed and Fortify is not something, it's not an organization only to help, you know, the need, to cover the need, the basic need, but as well bring resources. That's why I'm fighting, and I don't like fighting word. I'm just passionate. I was working hard with the team that I have, that, by the way, is only volunteers. We don't have any, we cannot pay because I didn't receive any grants yet. But what we need to work is in education. So I'm working hard to have a mobile unit to STEM programs. So I can bring this big mobile unit to the hotels and bring after-school programs with STEM programs. It is a beauty to just cultivate in the kids the opportunities to, the governor say it later, right? We need more STEM, more people in science, technology in this state, so we can bring more things. So thank you very much for the opportunity. If anyone wants to know more about, because my time is out, I will be. Seniors is something that we forget about it. Even in even the population that are coming is between, is millennial, 18 years old to 34. The senior community, because it's not the majority of the community, is totally forget. It's not the people that come from Puerto Rico with a pension of $400 because they cannot demonstrate, and it is hard. So don't forget about the seniors. Also, they have a big issue with that. They have like, I don't know how to say, lo botan en la calle? How you say that? No. They drop it. Drop nannies. Yes, they drop nannies. That means they go in a car, leave the senior in a corner, and fly. So they abandon the seniors. It's a huge problem right now. Oceola Council on Aging has been dealing with that situation. So we need to embrace our community from zero to seniors. Thank you very much.
Thank you. Thanks to our panelists, and we're going to move on to our last topic so that we are on time for lunch. So if I could call, thank you very much. If I could call to the floor my next three panelists on the healthcare issue, Dr. Fernando Rivera, Jimmy Torres, and Steven Lopez. Thank you. So moving on to the healthcare topic. First, we have Steven Lopez, who's the manager of healthcare policy project at the National Council of La Raza. We have Jimmy Torres, who is the president of Iniciativa Acción Puertorriqueña. And we have and Dr. Fernando Rivera, who's a professor of sociology at the University of Central Florida. Welcome. And we'll start with Steven, who has a very short presentation. Do you have the remote? Do you have it? Okay.
That's mine. That's mine.
Huh?
No.
So while he's getting the presentation up, I just wanted to highlight something that I think every panelist has said so far, each panel, that there's a shared destiny here, that what happens to the state of Florida, right? The nuestras familias puertorriqueñas, it's hand in hand. And so all of the topics that we're talking about, again, what impacts Florida is going to impact our community and vice versa. If it's impacting our community, then it's impacting the state of Florida. And so I think as we talk about healthcare, the same thing, that what we're seeing, overall is going to have a direct impact on the Puerto Rican community. So again, there is this shared destiny that I think more people need to understand and be aware of moving forward. And so, at NCLR, we believe, and this is, I think, is an important value, that every kid, every child in this country deserves the opportunity to be healthy. But we know right now that that opportunity is vulnerable. It's under threat. And so today I want to talk about two things in the short time that I have with you. And one is the opportunity for health insurance. How many of you have heard of the Affordable Care Act or Obamacare? Just raise your hands if you have. All right.
Everybody.
Well, we think it's important that everyone has the opportunity to have health insurance. But if you've been reading the newspaper or watching the news lately, you know that there are attempts to repeal the law. And I just want to give you a sense of what the proposal is to repeal this law and the harm that it would do. One, there are over 1.7 million folks in Florida who got health insurance through the health insurance marketplace this year. 1.7 million. 90% of them got some financial help. They got subsidies to help pay for their insurance. That's under threat of being taken away. 1.7 million Latinos in Florida get coverage through the Medicaid program. That's under threat of being taken away. 200,000 Latinos in Florida would gain health insurance if the state expanded Medicaid. That's under threat by this repeal of the law. So I just want to make it clear that while the Affordable Care Act isn't perfect, there's room to improve on it to make it work for more people, but we just don't throw the entire thing out and say, let's start from scratch. Let's figure out where we can make improvements and build upon those gains. And so that's one thing that I want to highlight, that law is important, and what's being proposed will inflict harm and pain on our community. The second thing that you might have been hearing, especially in the past couple of days, is that there's been a discussion about subsidies for low-income people to give them a little bit more help to provide for their health coverage. It's a little complex, and I don't say that because I don't think we can't all understand. It's just the politics of it are complex. But one thing that is important to know is that nobody really opposes giving these subsidies to low-income people to make their care a little bit more affordable, right? And this is about 7 million people that would be impacted if these subsidies are ended. And this isn't just something that's like being proposed down the road. This is for people who have insurance today. So let me ask you, what happens if these folks aren't able to get subsidies and insurers have to figure out where to get the funding to make up this gap? Where do you think that's going to come from? It's going to come from the insurance premiums that all of us, or many of us, pay. So we have an interest in making sure that this commitment is kept to low-income people. And very few people oppose it. The chambers of commerce don't oppose it. The health insurers don't oppose it. Members of both parties don't oppose it. But the administration has not made a commitment. The administration has not made a commitment to say that these subsidies are protected. So that's one of the things that is going to impact not just the 7 million people who rely upon these subsidies, but many of us in this room, because we're going to see our premiums increase in order to take care if these subsidies are ended. So that's important that you all know that and understand that, and that your state legislatures understands that, and they're making noise to pressure Congress to do what's right, to pressure the administration to do what's right. So I talked about health insurance a little bit, but I have to wrap up. But the other thing that I just want to point out, which I think is important for the health and well-being of our community, is the issue of nutrition and hunger. We know that nearly 20% of Latino households here in Florida don't have enough food on a regular basis. And they go hungry. And we know what that means when folks don't have enough healthy food to eat, right? We know that not only hunger, but it has other health outcomes, right? We see if you don't have access to healthy food, how it contributes to diabetes. We know when our kids don't have full stomachs in the morning, how that impacts their ability to learn in the classroom. We know that, sometimes if folks don't have access to healthy food, it contributes to things like heart disease. And we know that our community is already feeling those conditions already. And so limited access to healthy food, to good, affordable, healthy food, is something that's really important to our community. Well, once again, this opportunity to be healthy is under threat. There's a program called SNAP, the Supplemental Nutrition Assistance Program. It used to be called food stamps. But we know that this is a critical resource to giving folks an opportunity to have healthy, affordable food on a regular basis. But it's vulnerable to being cut at the federal level. But again, you all have the opportunity to raise these concerns with your local and state elected officials, to tell them that these are the needs and priorities of our community, of our kids and families, and we need you to be doing everything that you can to be pushing people in Washington, D.C. to do what's right by our kids and our families. So the last thing that I'll just say, because I'm out of time and I'll hand it over to the next one, is that your voice matters, probably more important than ever. We're seeing what's happening across the country when folks stand up and speak out and, again, elevate the needs and priorities of the community. And that's exactly what we need here. I may be talking about things that are happening in Washington, D.C., but the impact is going to be felt in our communities, in our families, in our schools, in our jobs, in our churches, in this room. And so I can't say enough about how much we need your voice in this debate. And I even had a slide to remind me, in case I forget, that tu voz cuenta. We need your voice in this fight. And so, again, I just want to thank you for listening, and hopefully something of what I've said is going to motivate you to, again, tell Tallahassee that our families and kids matter, and we need you to fight for their health.
Thank you. We're listening, right? Jimmy, I wanted to ask you, what are the healthcare needs that your organization is helping with, particularly the newly arrived Puerto Ricans?
Well, first, thank you for having us. We are here from Iniciativa Acción Puertorriqueña, and I want to recognize first, I think Wanda Rentas, Emily Bonilla, I think it's somebody from Marco Rubio's office. And why I recognize them? Because we came to Tallahassee to impact Tallahassee, to make sure that the people in Tallahassee listen to us. I'm really disappointed, and we have to work in our next visit here to make sure that staff. We know that there is a session going on, so legislature cannot be here, but their staff can be here. People from the Department of Health should be here. We need to make sure that people understand that when Puerto Rican talks, we need to listen. We're 1 million Puerto Ricans in Florida, and we have. It is cool that we dance and that you come to our parades and you take the picture with us, but we need you to hear what the problems are, and the problems are huge. Like the new president said, huge. They're huge, but it's also sad. So I'm gonna move away from my presentation. Sorry, Cincy Hernandez, that worked so hard in doing for us. But I think we only have like 7-8 minutes, and the food is already taking over. But listen, I was reading the paper from Puerto Rico, and there's babies are being born with defects, Zika virus defect, because the mothers could not get an appointment with the doctor or the laboratory to make sure that they're okay in order to start planning their family. That is sad. And when there's one of the party that called that themselves a fiscal responsibility party, I think this is very responsible not to fund the healthcare system in Puerto Rico that it's gonna cost, at the end of the day, it's gonna cost billions of dollars more money. If you don't spend the money now, you have to spend it later. And as I said to some of the politicians that I talked, I said, look, you can fix the problem in Puerto Rico. You can help us fix the problem in Puerto Rico, because if not, the problem is gonna get into JetBlue or American Airlines and will come here. So it's gonna bring the burden to the that's the correct word, burden, to the tax system here. And we need to tackle when we could. So right now, and this is a question by Telemundo today, why we're here in Tallahassee? Does Tallahassee have the capacity to help Puerto Rico? And the answer is yes. So there's entire delegations of the two political parties that can write to the governor, write to Congress, and make sure that Congress and the President of the United States takes care of the problems in Puerto Rico. And if they take the care of the problems in Puerto Rico, we can improve the situation in Puerto Rico, and then the people can stay there. Because sometimes people don't understand. Nosotros no nos queremos ir de la isla. I don't care about Florida. I don't want to be here. Right. And as many of you, you don't want to be here. You're here because the situation in Puerto Rico is hard. But when we got here, and Tony, we're voting. We're organizing. Boricua vota. So we're going to vote, and we're going to elect the right people, and we're going to make sure that they listen to us, because if they listen to us, they can take care of the problems there, but also here. Because what we heard before is that we need a system fully funded, so our people, when they come here, they take, and I said this, and I'm going to close with this, sorry. We don't want anything. We're not asking for anything. We just want what we deserve. We want the same kind of opportunities that other communities have in the 60s and the 70s. That's why they're successful today. The Cuban community in Miami and those other areas got great opportunities in the 70s and the 80s. So what we want the same thing. We just want the same thing. So the people that came from the Vietnam War, they got all kind of housing and loans and student loans. What we want for Puerto Ricans, we want the same thing. So if we access to that, we're gonna progress, and the entire community is gonna progress, and the entire Florida is gonna progress. And thank you very much.
Thank you. And Professor Rivera is gonna give us his perspective.
All All right, good afternoon. Buenas tardes. So I come between you and lunch, so that's my position out here. But first of all, I want to thank you for having this opportunity. As an academician, we usually don't get to talk to the public and the policymakers, but I'm going to give you sort of a different perspective of some of the issues that we talked about today in terms of healthcare, and I'm going to give you some sociological and public health observations on health and healthcare. So I'm going to quote James House, and he has this book. He's a sociologist and a public health professor, and the book is called Beyond Obamacare, Life, Death, and Social Policy. And he examines the current paradoxical crisis of healthcare and health that we have in the United States, which is we spend more and more for healthcare and insurance, both absolutely and relatively to all other nations in the world, yet we get less in terms of improved health, as shown in major indicators of population health. So basically, I'm talking about population health. I'm not saying that we don't need healthcare reform or anything like that, but I think we need to change a little bit of the mentality of how we do healthcare reform. He goes on to state, population health will be improved not primarily by biomedical science and practice or healthcare reform, important as this remain, but rather by recognizing and using all social or public policy as a fundamental basis of health policy. And I'm going to emphasize on that. Social or public policy as a fundamental basis of health policy. One of the things of coming last in the panel, we laid out all the issues that we talked about in terms of this. So I'm going to emphasize some education and income. We have vast evidence, social science evidence, public health evidence. We know that increasing years of education causes increasing levels of health. More education, better health. Yep. If you think about it right now, why do we have a young Puerto Rican population? We saw the stats of the kids in the elementary school. This is our chance, right? All right, so if you fell out of the education system, income is important in slowing the progression of health problems and delaying mortality. So those are profound social policy measures that we can have. One of the things that I've done in my research is looking at those things. People ask about seniors. Unfortunately, in part of my research, when we look at the indicators of population health among Puerto Ricans, both in the United States and Puerto Rico, we lag behind all other Hispanic and Latino groups. We have the worst health indicators. Cardiovascular, disability, you name it, we have it. Diabetes, all of those. But we did a study, my colleagues and I did a study, and basically we looked at disability rates of all those Puerto Ricans in counties that had enough numbers of Puerto Ricans with disability rates. And we found that in Florida, they had better indicators. So meaning that, hey, we're doing something right out here. And one of the big issues that we argue out here is because still we don't have a large residential segregation. And like Jimmy was saying, we need to learn from the experience of the past, right? We cannot continue having a Puerto Rican underclass here. I think we have a great opportunity right now in terms of looking at that. So my research have found that basically that Puerto Ricans living in counties with higher levels of segregation had lower levels of education, income, occupational prestige, and were more likely to live below the poverty line than Puerto Rican living in countries with lower levels of segregation. One of the things that I know, again, lunch and a little bit, I want to conclude by reading a quote from one of my participants in one of my published research projects. And I want to emphasize, and we emphasize sort of the issue of migration here to the United States. People think that this is moving from San Juan to Caguas or something like that. This comes with a very emotional toll. So I'm going to tell you a little story to end up this. So, in other cases, difficulties related to finances affecting Puerto Rican families' abilities to nurture and maintain ties with kin. So Jesus relocated from Orlando to Puerto Rico from Puerto Rico in 2007 due to the economic situation of the island. In Orlando, he worked 2 jobs and spent considerably less time with his children than he did on the island. And I quote, "I literally saw my children all the time after having a relationship where they couldn't go to sleep, and I tucked them in Puerto Rico. We had a very family-oriented life. When I came to the United States, I had 2 jobs. I started at 3 in the morning at the airport, When I got off work, I returned home. The kids weren't there. I had to go out again at 3 in the afternoon to work at the county. I was out by 11:30 at night. And I went directly to the airport parking. And I slept in my van until 3 in the morning. The distance was too much. I had no time to travel. I could only see my family on the weekends. Unfortunately, one of the consequences of coming to the United States was literally losing my son. He couldn't deal with this country. And basically the son said, I don't like this, I'm going back to Puerto Rico, and haven't spoken to their family again. So, to give you in a more uplifting note, we have a great opportunity to improve the health and social conditions of all Floridians by investing in stronger and healthier communities. And remember that social policy, investments in education, housing, jobs, income inequality, solving all those issues is health policy. We don't have to rely only on healthcare reform. Again, so I leave you out here, and there's a lot of research doing that, but social policy is health policy. Thank you.
Thank you.
Thank you, Professor. Thank you to all of our panel. If anybody has a question, we really have no time for them. I think we have a next panel before we serve lunch. But is there any question? No? Thank you very much again.
No?
No, there's another panel.
There's another panel.